Hi everyone, and welcome to week 5 of Contemporary Issues in Public Health. This week we're going to be looking at communicable diseases and the role of public health and communicable disease in this contemporary era. So we know that public health really began around trying to contain and prevent the spread of epidemics of communicable diseases. We're looking at cholera and diphtheria and Spanish flu, all those huge epidemics around the turn of the 19th, 20th century that had catastrophic effect on populations, huge amount of death and disability. And we were relatively successful in terms of the eradication of smallpox and a lot of control over vaccine-preventable diseases such as polio. However, it was even to the point that in 1970, the Surgeon General at the time in the US stated that it's actually time to close the books on infectious diseases. He felt that the role of public health had done so well in maintaining and preventing all these communicable diseases that it was time to stop these problems and move on and really focus on non-communicable diseases. However, infectious diseases are still one of the leading causes of death worldwide. And this is particularly to the point now because they don't confine themselves to national borders. They don't stop within Australia or they don't stop within their country of origin. And as times change, and we'll look at this a little bit more, we're going to find that spread and that ability of infectious diseases to spread rapidly one of the main issues. We know that infectious diseases currently still are a cause of 63% of childhood deaths and 48% of premature deaths worldwide. So we're talking primarily developing countries still, but also developed countries, and we'll look at that also. So this is just showing us that the number of outbreaks of different communicable diseases, be it zoonotic diseases, vector-borne bacteria, are all increasing. So this was what public health was founded on, and it is a continuing issue. We haven't got on top of these things. It's something that is still a massive component of public health practice. And I also want to point out that it's not just in developing countries. Yes, a large portion of some of these communicable diseases are in developing countries, but it's relevant for Australia. If we look back at our influenza period last year, it was a massive spike, and it was, you can see here, one of the worst influenza outbreaks since 2012, and by a huge spike in terms of the amount of confirmed cases. So it's not something that just happens in developing countries. It's still continuing to increase and be a massive concern for public health within Australia as well. So let's look at the fact that there's still a reoccurrence and a re-emergence of old issues not yet solved. Okay, so we've got a resurgence of diseases that were considered to be under control. We thought that measles was almost eradicated, and it very nearly was. We thought that we're on top of cholera. We thought that malaria was starting to be contained, whooping cough, pertussis, dengue, typhoid, influenza, polio. However, they're starting to come back, okay? And there's a lot of reasons why this is the case, but it's something to really bear in mind that what we thought was a closed chapter, and we think back to the US Surgeon General's report in 1970, he thought that was a closed chapter in the history of the globe, but it's very much something that's coming back. That resurgence in communicable diseases is something that we still need to be very aware of. Okay? This is a cholera outbreak between 1989 and 2016, and you can see the spikes that are continuing to happen. And again, this might be more common in developing countries, but it's something for us to be aware of across the globe. Tuberculosis. We know that tuberculosis still kills more people than AIDS. It's still one of the #1 killers on a global scale, okay? And the sustainability goals are really looking to focus on how we can end TB. Now, this is tied to poverty often and tied to many of the social determinants of health, and many of these issues need to be addressed before we can start to curtail this continuing increase in tuberculosis. But what I really want to point out is that it's not just a new and emerging communicable disease. It's an old issue that we haven't got on top of. We need to look at better ways of treatment, better ways of containing, and better ways of preventing this increase in the future. Pertussis or whooping cough also, so it's not just developing countries, and it's not just tied to those low socioeconomic countries or those social determinants of disease. Look at this huge spike in pertussis or whooping cough notifications in New South Wales between January 2012 and January 2016. Okay, so we need to start looking at why there's a sudden spike again in what was thought to be an almost eradicated communicable disease is now seeing a dramatic comeback to having devastating effects. So we've got those old issues, but we've also got emerging diseases. Okay, so we know that over 20 new pathogens have been discovered since the mid-1970s, okay? We know that there's new diseases in that time, such as HIV/AIDS, hepatitis C, Zika, and Ebola, dengue, all these new and emerging pathogens that are also causing devastating effects for populations across the globe, okay? The emergence of AIDS pandemic 30 years ago has had a devastating effect across the globe, okay? So it's not just those developing countries as well that we often focus on with these, but it's had a devastating catastrophic effect globally in different and specific populations across the globe that we need to be considering as well. So we think about these in absolute numbers, you know, a summary of global HIV epidemic as of 2016, 36.7 million people are affected globally, okay? 2.1 of those children. So we really need, and there's still 1.8 newly affected. Again, we're not getting on top of these communicable diseases. What thought was to be a closed chapter, we can move forward, and all the trends were going down, are very much seeing still a surge in populations that are affecting and people that has a catastrophic effect on. So why? It really comes down to the globalization and the rapid change that we are experiencing as a globe. And a rapid change not only in environment, so that comes down to the change in environment from a climate change perspective, a change in environments from political and change in borders, and movement of people, which we'll come back to more in a moment, but also a rapid change in microbes. These microbes and pathogens are developing, they're getting smarter and more resilient and more resistant and continually changing, and we aren't keeping up. The technologies and the rapid change of those microbes are at a pace that we often can't keep up with. And a classic example of that is that mutation, that change in viruses such as SARS or bird flu. And as it spreads and changes and mutates, we don't have the technologies or abilities to keep up with the speed that it can change. And again, that ties nicely into this component of why air travel and movement of populations. We have this huge movement continually, globally, of people across the globe. They're going to take one type of microbe and transport it right to the other side of the world where you've got another vulnerable population waiting. It might mutate in that jump. It might mutate to something that we don't have a solution to at that problem. So this movement across borders, this movement, this integration within populations, and this rapid change in environments is a perfect melting pot for this to all occur. Compounding that is civil unrest and war. Okay, so you've got vulnerable populations, you've got susceptible people in often war-torn environments. Not only do you have the debilitating effects of war itself in terms of combat and injury, but then you add in populations that don't have sanitation, who don't have safe drinking water, are often immune suppressed because they're stressed and they're moving on, they're malnourished. is a perfect situation for an outbreak of these communicable diseases to spread like wildfire. Classic example of that, and they're very worried about that, is the movement of the Rohingya peoples out of Myanmar at the moment. Okay, they're in these temporary locations. The monsoon rains are coming. There's no sewage. There's open defecation. And there's huge amount of people. So that's gone from movement of populations due to civil unrest and war, and now it's a perfect melting pot for an absolute catastrophic epidemic of all sorts of communicable diseases. Another element of it during this time is that you've got a break in healthcare systems, okay? Young children aren't being immunised during civil war. They're then directly vulnerable to what was previously eradicated, such as polio and all of these immunization programs that are set up within countries and structures that happen. But if they're displaced people, then they're not going to be able to obtain those vaccinations. Natural disasters, again, comes back into climate change. We're going to see increasing amounts of natural disasters, and we're going to see increasing amounts again of outbreaks and epidemics to follow on from that. Animal husbandry, okay, so we've got a lot of populations moving. We've got a lot of populations living still closely with animals. So they either live on top of cattle or live on top of pigs. Or in the case of Ebola, they're actually living in the jungle. So Ebola actually jumped from monkey to human, okay, and it's actually out of the jungles in Sierra Leone. And there's two elements to that jump. One was that there were civil unrest and war has led to famine, and also it led to limited food sources. So they were living in the jungles and they were eating jungle meat, okay? And that jump from the zootonic infection and mutation from the virus to go from animal to human was incredibly easy. And as we know from the catastrophic events of Ebola, it evolves very readily and very quickly. And one we see quite frequently in Australia is anti-vaccination movements starting to really drop those rates of vaccination, resulting in a reduction in herd immunity. And it has serious effects. And in Australia, we've seen a direct effect in pertussis and whooping cough outbreaks. And now in the UK and Europe, we're seeing outbreaks of measles. So, and that's can be directly attributed to a reduction in vaccination and conscientious non-vaxxers causing that break in herd immunity. So where we were getting on top of this, we're now starting to see a breakthrough of these communicable diseases again. I love this map because it really shows our interconnectedness. This is a mapping of the amount of flight routes there are across the globe, okay, and just how quickly and how effectively these pathogens can move from population to population. And in light of that, this is a map from 1990 to 2014 to show exactly that, to show this map of pathogens moving across the globe, okay? New and emerging, we can see Zika there, we can see MERS, we can see pertussis, we can see H1N1 influenza, cholera. So old, emerging and re-emerging diseases that follow those path routes, okay? So if you overlay that path route, those flight paths with this map, you can see a direct correlation. So we know that this is something that is increasing, and we know that it has to do with movement of populations and the growth of populations. So by 2050, we're going to have 9.7 billion people globally. How can we stop catastrophic human loss from communicable diseases occurring? And that's really what our role as public health practitioners and our role in the public health sphere has to do with communicable disease, and that's control. Okay, so there's many ways or several main ways we can come at controlling these pathogens, and it's not a single one in isolation. Again, it's that interconnectedness that we've talked about before, not only with stakeholders, but also within measures and control measures. So with vaccinations, there needs to be a strengthened international effort and funding to promote immunisation, okay? We need to rebuild those thresholds, build up back up to that herd immunity levels. We need to get better at communicating. Disempowering that false information and really looking at the communication, effective communication, to combat that false information about immunisation. That and us as public health professionals really need to step up to the mark in terms of communication in that sphere. That's a lot more in developed countries. In developing countries and more term countries, we need to work together to make sure that there's a rollout for vulnerable populations and continuing that trajectory and uninterrupted immunisation program of children across the globe. It can be expensive to develop new vaccines. It can take a long time, 20 to 30 years. And this is something that happened with Ebola. So obviously now there is an anti-vaccine for Ebola, but there wasn't one when the height of the epidemic was happening in Africa. And people were scrambling, they're costly. It takes a lot to develop. So we need to maybe try and use forecasting and look at how we can get what might happen and how we can start to develop vaccines prior to an epidemic occurring. And a part of that is surveillance and really looking at monitoring, detecting, promptly investigating, and monitoring emerging pathogens, really tracking those diseases and pathogens globally and where they might do that jump or that mutation from animal to human or human to human, and how we can get on top of it quickly and readily. And again, this ties nicely into early detection. We can get onto it early, we can stop it jumping, we can stop it building that resistance, we can stop it really growing at a rate that we can't contain, okay? And this is particularly essential for looking at the resistance and the growing resistance as it tends to mutate in a lot of pathogens to antimicrobial drugs, and which are one of our number one sort of tools in our bag to get on top of a lot of these epidemics, these communicable epidemics. If we don't have that tool, we're going to be stuck. And a key player in that, and I've talked about previously, the role of big data in getting on top of Zika and using big data to really map the movement. We can map someone that moves from Australia to the US using big data. We can really start to not just look in those silos, but use that big data to map the movement of people, the movement of disease, and really start to get to it early, and look at really using this to build vaccinations, to build interventions, to curtail that potential catastrophic event. So for the future, and something for you to think about as public health practitioners, these are the big issues, okay? These are the big black cloud hanging over us that we need to think about in terms of where we go from a biotechnology point of view, where we go from a population public health management perspective in terms of stopping that jumping or stopping that spreading, be it better measures in place for displaced people, be it better tracking in place to stop that emerging strain that is jumping at a rate that we can't keep up with it. And then looking at our use of antibiotics as well. We used to use that as a one-size-fits-all. We now know that that's not going to be possible in the future. We need to really start pulling back and looking at what other technologies we can use to help combat communicable diseases, because the growing rate of antibiotic-resistant strains of a whole lot of things like Streptococcus and other very potent and dangerous strains of pathogens, we really need to revisit our antibiotic use within our healthcare systems and our overprescribing of antibiotics. So like I said, as public health practitioners in this era, it's becoming more and more complex. Our practice really depends on that interdependency all those stakeholders we've talked about working together to really look at developing equitable, coordinated approach using new technologies. And that's where you all play a key role, and it might be locally, it might be, you know, in one of these developing countries, working on surveillance and movement of disease. It might be in the forefront, working on the ground in a refugee camp in Bangladesh as people flee from Myanmar. Wherever you might go, wherever your career will take you, you're going to need to think laterally and really look at working together to combat these emerging diseases and re-emerging strains of communicable diseases in our future. Thank you.